Well, welcome to the Retirement Answer podcast. I'm Dan Goldie, your host. I'm the author of the upcoming book, The Retirement Answer, and this is the podcast where we solve complex financial decisions and simplify them for you. And today, Monie, we have a difficult one that we need to simplify for everyone. This is Medicare.
Alphabet soup.
It's a mess.
Yeah.
Everyone agrees this is a disjointed type of program, and we're going to explain to all the viewers why it is that way. It has to do with the history of the program and all the political adjustments that have been made. What do you think? How should we go about this?
For me, this was probably, this and the distribution chapter were the most complex bits of the book. And I had no idea how much I didn't know about Medicare until I read your book. And it's really complicated. And I think part of what helped me understand it was the history. It provided some context about it. So I think maybe you should start by just giving people a rundown of where all of this came from. And at the same time that you're giving them the rundown, we can start to talk about the vocabulary, some of the vernacular a bit, so that it's not as complicated when we get into how it actually works.
Okay. Well, so Medicare started, it began in 1965. So it's later than most people think. It's later than Social Security.
Right. I originally thought it started in the 40s or something. Yeah.
It was a problem because it was desperately needed, this medical coverage. And so in 1965, all the political parties, they battled it out and they came to some kind of an agreement. And that's really where all of these different layers, in fact, they called it at that time, they called it a 3-layer cake because there were 3 different points of view that were considered and incorporated into the program back in 1965. So let's run through it real quickly. The Democratic perspective or preference was to have this be universal coverage that didn't cost much for people, really not costing anything. And
universal insurance.
Yeah, and that became Part A, where they wanted this hospital coverage. That's what Part A is for primarily, is inpatient hospital coverage. They wanted that to be very inexpensive, which it is, but you have to qualify for it by the number of years that you work. So you have to have 40 quarters, much like Social Security, or 10 years of paying into the system. And then most people don't have any premium to pay for Part A. And they get pretty good coverage. There's a deductible amount of around $1,700.
Which is minuscule when you talk about hospital stay.
And also the coverage after that, there are some limits to it and some payments that you have to make eventually if you stay at a long time in the hospital, but it's a pretty low cost part of the whole system.
Sure. And then there's Part B, right, which is the Republicans' contribution to the 3-layer cake. And as you would think, the Republicans wanted a kind of a system where the covered individual actually has a skin in the game. So you have to pay for Part B based on your income. And Part B covers your outpatient care. So it covers your primary care doctor. It covers your general health care needs, everything but hospital stay and services. So hospice, things like home health, all of the hospital stays are covered by Part A. And what you would think about as your normal sort of, doctor visits and healthcare provider needs as an outpatient are taken care of by Part B.
Yeah, and so those were what was discussed in 1965, and that's 2 layers of the 3-layer cake. The 3rd layer is what the doctors wanted, the American Medical Association. They didn't want any of this socialized healthcare. They figured that was not good for their
profits.
So they ended up. Their preference ended up becoming Medicaid, which is really healthcare coverage for folks that are below the federal poverty line. And those are the 3 different layers that were set up in 1965.
And Medicaid really has nothing to do with what we're talking about here today, right?
No.
Really, because I find people get confused between the vocabulary there, like the wording there, because Medicaid, Medicare kind of sound the same, but Medicaid is really just for people that are living. It's basically insurance coverage for people that are poor.
Yes.
Yeah, it's a subsidized insurance coverage for people that are poor.
And it's run by the states.
Right.
That's the critical difference is Medicare, the thing that we all think about, that's run by the federal government. And Medicaid is, I think it's administered by the states. It's a federal program that's administered by the states.
Right.
So there's another difference. But most of what I wrote about in the book and that we're going to talk about today is going to be Medicare. That's pretty much everything we're going to talk about.
Right. So far we've gone through Part A, Part B, the contributions that were made by Democrats and Republicans there, and the fact that this all started in 1965. But there's also a Part C and a Part D, which got tagged on in the early 2000s in the Bush administration, and I'll let Dan take it from there. What can you explain what Part C is?
Well, it's become known as Medicare Advantage. And this was the attempt to find a more efficient way using private healthcare coverage to offer these benefits to people. And so this was put into place in 2003. The first attempt was actually in 1997. That wasn't successful. The costs were too high and private insurers left the program. So then it was revamped and renamed by the Bush administration in 2003, as you mentioned. And that's where Medicare Advantage came from.
Right now, we should be understanding that Part A is your hospital coverage. It's your inpatient kind of care. It's hospice, it's home health. Part B is your outpatient coverage. That's covered. And you're paying a little out of pocket or more than a little out of pocket. We'll talk about that for Part B. Part C came on way after A and B were put into place in the early 2000s, and it's a way to simplify Part A and B into a single kind of wrapper type insurance policy. And Part D also came along with Part C, which is your prescription coverage, which didn't exist in the original Medicare enactment. So,
well, what this ends up leading to is you have two paths that you can go down.
Right.
So when you're signing up for Medicare, you really need to decide within about 6 months of signing up, for example, because if you go with the original Medicare route, if you sign up within 6 months of turning 65 and starting Medicare, you don't have to have a medical underwriting process that you go through to get your Medigap insurance. And we should talk about what Medigap is too,
Exactly.
because there's another name that people know, but they don't really know what it is. In any case, you have two paths that you can choose when you enroll in Medicare. You can go with the Medicare Advantage route, or you can go with the original Medicare route. And if you go with the original Medicare, which, as you explained, it's a little more complicated, because you have basically three insurance policies that you have to pair together, because Medicare itself has gaps in it. So that's what led to this Medigap insurance solution to fill that gap, where that insurance, which is a separate premium, by the way. So you have not only your Part B premium, but then you have your Medigap premium, and then you're also going to want to get prescription drugs on top of that. So you've got Part D premium.
Okay, so now we're getting complicated. I'm gonna pull back for a second as the audience proxy and kind of summarize what we've talked about so far. So Medicare is this alphabet soup of medical coverage that you get as a senior. And it is as Dan puts it all the time, it's a cost-sharing plan. It is not free, okay? There are multiple parts to it that describe how the plan behaves. So there's a Part A, there's a Part B, there's a Part C, and there's a Part D. A and B were the original bits. A being your inpatient coverage, B being your outpatient coverage. A was relatively cheap or free, pretty much, and B you had to pay out of pocket for. Then C came along, I'll explain that for a second, and D came along. D is prescription coverage. C is the ability to get all three of those things in a single private insurance wrapped insurance coverage that simplifies all of that for you. There's also this concept of Medigap, as Dan was talking about, which is if you decide not to go with C and you're getting A, B, and D, you're going to be paying out of pocket for B, you're going to be paying someone out of pocket for D, and then you need this gap insurance, which covers what the insurance doesn't cover in the case of, people have horrible sometimes circumstances where, either your outpatient care or even your inpatient care doesn't cover the entirety of what you need. And that gap insurance is there to provide that difference. So,
and it also covers the 20% copayment that you're responsible for. Oftentimes those policies cover that part of
which can be
the
substantial,
cost.
20%.
Depending on your health experience,
that's right.
Could be very substantial.
Right.
So
and so Dan, like if I were to ask you, as a professional, why would someone choose the complexity of A, B, and D as separate kind of entities that they have to then manage, and plus gap insurance on top of that? So you've got really three premiums you're paying.
That's right.
You're paying for the B premium, you're paying for your gap insurance premium, and you're paying for your prescription drug coverage premium. Why would I do that if I could just go to a private insurance provider and say, hey, I'm going to sign up for Part C and make this really easy for myself. One premium covers all of it.
Right.
I don't have to deal with it.
Well, you've mentioned that's the main attractiveness of a Medicare Advantage going down that route, is just as you described. The original Medicare alternative is more expensive monthly, because you have these three premiums, like you said. But when you have an event where you go and you get medical treatment, then it's cheaper that way, and the costs are more predictable. It's also more flexible in that you don't have to get a physician referral if you want to go and get treatment. You don't have to stick with a network, which is what you have to do with Medicare Advantage. Probably people might be familiar with that with their work coverage, where they have a network and they've got to stay within the network. So there's more flexibility. For example, if someone travels a lot, then the original Medicare is more attractive, or if they're going to move.
So it's sort of simplicity versus flexibility.
Yes.
In one case it's easier to use. In one case it's a little bit more complicated, but you get all this. You get more flexibility in terms of your benefits and how you can utilize them.
And the expenses are more predictable with original Medicare, because if you're when you have an event where you need care, the costs are fairly they're managed. They're lower than with Medicare Advantage. So, as I understand it, the benefits, or the costs, I should say, are more predictable.
What's funny? I had this conversation with my dad the other day after reading your book, because after reading Chapter 3, I had no idea, by the way, how complicated Medicare was until I read Chapter 3, and my head was kind of spinning after that. It took me a little. I mean, that's a chapter you guys got to read like a couple of times if you're picking up the book.
I would say at least twice.
Yeah, I mean, it's not an easy concept to pick up. And I went up to my dad because he was a fairly high, income individual, was a pharmacist for a long time, and he understands the healthcare system. And I went, why did you pick Part C when clearly there's an advantage to sticking with standard Medicare? And he liked the simplicity of Part C. For him, it was like, hey, I guess there's all these insurance programs where they find out that you're about to retire, and then they'll hit you up for sticking with your same insurance, but using your Medicare coverage. So that's kind of their Part C. And he was like, they told me I get to keep my doctor, I get to keep my network, everything I'm happy with already, and I switch over, and my premium came down. So I picked Part C. And for him, it worked out.
I think you're mentioning he's not planning on traveling a lot.
He's not planning on traveling a lot.
He's not going to move to a different state. His doctors that he likes are in the network.
Simple
so
for him.
For him, it makes sense.
Made sense. And so I finally understood, after talking to him, why people would go with Part C. I probably would go with Part C if I could, right? If I retired today and I was able to keep the same insurance I have, which I'm happy with, why not go with Part C?
And you also mentioned to me that your dad is pretty healthy.
Yeah, he is.
Yeah. So if he has an advantage, the higher costs, the higher costs for that don't bother him.
Right.
So these are the different trade-offs that everyone needs to consider when they're trying to choose which path to go down.
So Dan, what's the path to enrollment? We talked about what Medicare is. I think we put enough meat on the bone on that one. I think people understand that at this point. But now we have to get to the crux of it, like what the book covers in terms of how you enroll for Medicare, the implications of enrollment, and how it actually works in retirement.
Yeah, and the penalties that we all want to avoid.
That's right. That's what I wanted to get to.
Yeah, the main entry point is the initial enrollment period. And in the book, I mentioned that as the green door. So if you're thinking of 3 entry doors into Medicare, this is the main one where the light is green. There's no questions asked. You're enrolled. There's no penalties. There's a window of time where you have to enroll to be into that initial enrollment period, and it's a 7-month window around your 65th birthday month. So the 3 months before you turn 65, the month that you turn 65, and then the 3 months after.
Wait, that kind of surprised me actually in the book. The fact that you have to do this, right? That initial enrollment period, Dan calls IEP, the initial enrollment period in the book. And I'm curious I'm not curious anymore because I read the book, but from an audience perspective, what's the implication of not signing up in that period? Because again, this is like by law you have to do this. So what if I'm working? What if I'm like, that was the first question I had in my head.
Yeah, you're safe as long as you're working for a large company, and Medicare defines large company as a company with 20 or more employees. But if you're working for a smaller company, a company that doesn't meet that criteria, then you have to sign up for Medicare within that window. Otherwise, you're facing penalties. And the penalties are pretty steep, actually. So if you work for, in the book, I gave an example of someone who was working for a 12-person accounting firm, I believe. And she didn't sign up for Medicare because she continued to work until she was 65, and she was receiving her benefits from her company, her small company. So she figured she didn't have to sign up for Medicare. She would do that when she retired at 67. But because she worked for a small company instead of one with 20 or more employees, she's going to get penalized for being late to enter Medicare. And for Part B, the penalty is 10% per year that you're late. And that goes on for forever, for life. So if you have a Part B, let's say if you're a higher earner and your Part B premium costs you, let's say, $500, $600 a month, imagine that's a 20% penalty on top of that you have to always pay ongoing. So
that's for life.
It's for life, for as long as you have Part B coverage. So it's not a small number.
Yeah, that was kind of shocking to me. So what was shocking to me is that you have to sign up. Otherwise, there's this penalty. Unless you fit this exception, which is you work for a large enough employer that has coverage for 20 or more employees.
Right.
So
there's a lot of rules here, a lot of rules. Now, if you do work for a company that has 20 or more employees, then you're safe. You're not going to get penalized. You don't have to sign up for Medicare right away. You can wait until you retire and then go in what's called the SEP, the Supplemental Employment Period?
Special Enrollment Period.
Special Enrollment Period. It's so hard to remember all these acronyms. So that's the SEP, where you get in and you don't have penalties, but you do have to work for a large employer, and you do have to have what they call creditable coverage, meaning coverage through your employer that's at least as good as Medicare coverage. That's what they require. And if you meet all those requirements, then you're not going to face any penalties like the person did in the previous example.
Wow. So not only do you got to remember this alphabet soup of Medicare, but you also have to remember that within the 7-month period around your 65th birthday. So let me see if I get this right, even after reading the book today. So 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday, that is your enrollment period. So that's like
the initial enrollment period, the IEP. Period. Yeah.
Right. And if you're working for an employer that provides at least as good medical coverage, and the employer is large enough to provide medical coverage for at least 20 people, I told you guys this was going to get complicated, then you can avoid having to sign up for Medicare. You can avoid having to sign up for Medicare within that initial enrollment window.
You can go into the SEP.
And you get into what's called the SEP, which is you can wait it out until you finally retire or that coverage goes away, and then sign up for Medicare.
And in the book, I characterize the SEP as this second door, as a yellow door, because there's a lot of caution there. You've got to make sure that you meet all the qualifications so you don't get in trouble and have penalties.
Yeah.
And the penalties, by the way, for Part D, for the prescription drugs, is also pretty bad, although because prescription drug coverage is not that expensive relative to Part B, it's not as onerous as in terms of dollars. The penalty is 1% per month that you're late for Part D. But
that could still be substantial. I mean, if you forget it for like 3 years, or if you do something, I mean, that's like 36%.
Yeah, wow. But fortunately of a smaller number, because the premiums for Part D are considerably lower than Part B. But the penalties are still there, and they last for life.
So 7-month window within your 65th birthday, you decide you're going to sign up for Medicare. What are the costs associated now? Let's talk a little bit about, because you and I were kind of chatting about the premiums prior to this, and you had some input on that. So let's talk about what the actual costs are.
And also the coverage, you can have a gap in your coverage, which you don't want to have. For example, if you don't sign up within that first 3 months before your 65th birthday, then you may have a gap in your coverage, because depending on when your coverage ends elsewhere, where your private insurance coverage would end. The best time to do this is the best time to sign up, unless you're working for a large company, is during the 3-month window before you turn 65, because then your coverage would begin right on the first of the month that you turn 65.
Oh, perfect. So then you can basically have a clean cutoff between your private insurance and whatever you chose for Medicare.
Yes. In the book, I wrote that that's really the ideal time to sign up, unless you have one of these exclusions that allows you to sign up later, like working for a large company. And then the costs are, for Part B, dependent. There's something called IRMAA, which is, I need to remind myself what that is. It's it's adjusted for your income. So it's income-related monthly adjustment amount is what it's called. And that can raise the cost of the Part B premium significantly. The base for 2026, I looked it up, and the base cost for Part B insurance is around $202 a month, I believe. So call it $200 a month. But if you make more money, like all of my clients are making enough money in their retirement, that they're going to be paying a much higher premium than that. It can get as high as $700 a month, believe it or not. If you make more than $500,000 a year, as a single individual, or $750,000 a year as a married couple, then you're at that highest bracket of cost, which is approaching $700. And this, by the way, what they do is they look back at the 2 years prior to the year that you're doing this to look at your income. So
Okay.
a lot of higher income people are trying to adjust their spending and doing activities to try to lower that taxable amount to get their Part B premium down.
Right. So remember, just because you're retired doesn't mean you don't have income, right? Your distributions count as income.
Like IRA distributions, for example.
Right. So the higher the distributions, the higher the income, therefore, the higher this adjustable amount for your Part B coverage.
It comes down to effectively your adjusted gross income 2 years prior to the year that you're looking at this.
Which can be significant when you first turn 65 because you were working for the last 2 years. Let me kind of recap again because this is such a complicated topic. So we talked a little bit about the history of Medicare and the fact that it's this sort of 3-layer cake. We have talked about the different parts of Medicare. We have talked about the option to go with Part C versus original Medicare and what the advantages are there. And right now, Dan just talked about the enrollment period and the implications for the enrollment period and the special enrollment period. And we talked
cost.
a little bit about the cost.
And avoiding the gap in coverage.
Right. And the fact that you're going to be fined for life if you don't sign up on time and you don't fit the criteria for the special enrollment period, which is you got to work for an employer that's covering 20 or more people with a plan that's comparable to what Medicare provides. So we've kind of covered that bit of the landscape. Now let's talk a little bit about how people get some assistance with their Medicare coverage. And this is a complicated topic. Even if you go read Dan's book, I would still suggest that if you don't have a professional helping you, you get a professional to help you. And there's sort of two routes there. You want to talk about those two routes, Dan?
2 routes to get advice.
Yeah.
Well, there's the state provided.
It's called SHIP. SHIP.
Yeah. So these are advisors that are provided by the state. Mm-hmm. Various states. I guess all the states would have
states
this.
have them, yeah.
So wherever you live in the country, you can consult with these folks, and I believe it's free, right? You looked it up earlier.
Yep, it's free.
And then, of course, there's private advisors who have some cost to them. I don't know which one would be better, but those are the 2 ways you can get advice on this. I don't think many financial advisors really are at the level of expertise. I know I'm not, where I could advise someone on how to handle this. I really do think you need to go to someone who's an expert in this area.
I totally agree. I think this is such a complicated topic, and it's going to be so kind of subjective in terms of how it applies to your situation. Like Dan mentioned, in my dad's case, C was fine. He's healthy, and he doesn't travel out of state. He doesn't live out of state. You might want to live in 3 different states when you're retired. You might want to live in 2 different states when you're retired. That's going to have a completely different implication for your insurance coverage than my dad's does.
And you also might prefer to have more predictable costs and more flexible approach to
right.
what specialists you can see and so forth. You don't want to necessarily get limited to what's in the network, or maybe you don't want to get a referral from your primary care physician every time you want to go see a specialist. These are the kind of considerations that everyone needs to think about.
Yeah, and as Dan mentioned, if you want to get help, there's no reason you can't, because you don't have to pay for it. Every state has this thing called SHIP, which is the State Health Insurance Assistance Program. And each state is called something a little bit differently because, SHIP is sort of the federal name for it, but then there's the state administered.
And what's the California name? Yeah,
the California name was
you looked it up.
HiCap was the California name, which was God, I hate all these acronyms. Right? Health Insurance Counseling and Advocacy Program in California. So in California, where we are, as we've mentioned multiple times, you can go to HiCap, go to their website, set up a consultant, set up an appointment with a consultant, and they'll sit and talk to you and your family about what the best coverage is for you. So Dan, I know we've pretty much covered Medicare, all the different parts, enrollment periods, all that. I think it'd be helpful for people if you talked about the three examples. You put three concrete examples in your book these
Medicare are hypothetical, by the way. These aren't real.
Okay.
But these are three examples that I think illustrate the complexity of Medicare and how easily you can get into a problem. So, for example, this is the one I already mentioned. This one a bit, which is a woman working at a small accounting firm with 12 people. She didn't sign up on time because she was covered by her work, and she didn't think she had to, and so she had a 2-year penalty for Part B. 20% penalty.
Well, what about Part D?
She would get that also.
Yeah. So it's not just Part B. You get, and by the way, 2 years, that's 20% for Part B, 24% for Part D, for life. For life.
And so then the second example was about a gentleman who worked at a construction company of 18 people. So he just didn't meet that 20-person rule. And he signed up for parts A and B when he retired, but he did not sign up for Part D because he wasn't taking any prescription medication. So he figured, well, I don't need that coverage. I don't take medication right now. Then it turned out because he didn't sign up for D, he signed up for A and B. Then he needed the medication many years later. 5 years later, in my example, he had a serious heart condition and he needed a very expensive drug. And when he did sign up for Part D at that time, he realized that he has this 1% per month penalty, which is, in his case, 60 months. So it's a 60%
ouch
penalty that he has, again, for life on his Part D coverage, which fortunately is not that expensive, but still 60%,
yeah,
60% per month.
For life is a lot. I mean, let's just do a really simple number. Let's say it costs him $100 for his baseline coverage. So now it's $160 per month for life. And if you're going to live, another 20, 25 years, you can extrapolate that out. That's a lot of money. That's like, almost $800 a year for the rest of your life. That's a lot when you're retired.
That's right. And in the example that I wrote in the book, this is a woman who was working. She was laid off unexpectedly at age 64. So then she went on COBRA to continue the coverage that she was used to. It's expensive a lot of times, but many times it's the only available option for people. So she did that. And then when her COBRA ended at age 66, she signed up for Medicare. And to her shock, she was told that this COBRA coverage that she had, even though it was really good coverage and it was consistent with the coverage that she had at her job, that did not qualify as creditable coverage by Medicare. And therefore, so she ended up with penalties because of that. That's the story.
And that's another thing you have to remember. That
COBRA doesn't count.
COBRA does not count, right? Just because you're a big employer, you're working for a big employer before, now you have COBRA, doesn't count. So,
and in this case, in the example I gave, I'm just remembering now that when she signed up, she had to wait for the General Enrollment Period, which is the third window of the three. You got the IEP, the SEP, and here's the GEP, the General Enrollment Period. That's the red door that as I wrote in the book, this is the door you don't want to go through. You don't want to get Medicare through this door. And in this example, this woman she ended up doing that because COBRA didn't count. And when she did sign up for Medicare, she had to wait for the General Enrollment Period So think about this. Not only is she facing these penalties that we've already mentioned,
Right.
but she has a gap in her coverage because her COBRA ended, and then she had to wait for the GEP window before she could sign up for Medicare. So she gets penalized, and she's got a gap in coverage, all because she thought COBRA was creditable coverage, that accounted for that, and she didn't need to sign up for Medicare right away.
Right. And so another bit of alphabet soup are all these different EPs, right? So there's IEP, there is GEP, there is SEP. Let me kind of, as an audience proxy, review these with you. So the IEP is the green door that Dan talks about. It's the 3-month window right before your 65th birthday, and then 3 months post your 65th birthday and the month of your 65th birthday. So you have that 7-month window to sign up for Medicare. If you sign up in the 3 months prior to your 65th birthday, you get it right on your 65th birthday, and you can cancel your other insurance coverage. The idea there is that is like an open enrollment period at work. When you get open enrollment at work and you can sign up for insurance coverage and all these different benefits that work provides you, that's like your open enrollment period for Medicare. So if you're going to get it then. You have another option. If you're working for an employer that covers 20 or more people with the kind of medical coverage that is at least on par with what you're going to get with Medicare coverage, you can use what's called the Special Enrollment Period, which is you can delay signing up for Medicare until such time that you're not going to be covered by that insurance, and then you can sign up for Medicare. And for both of these things, you don't need to wait for the what they call the General Enrollment Period. But if you mess up, you don't fit the employment standard, and you forgot to sign up for Medicare during that 7-month window that you have to wait until what's called the General Enrollment Period, which starts in I think it starts in January, right? Or no, it starts the General Enrollment Period starts January 1st. I was right. So January 1st and goes to March 31st every year. So if you pass that window, you have to wait till the next year to get. So not only do you not get coverage,
you could potentially wait 9 months, depending on when that occurred.
So not only will you not have coverage for that 9 months, but you will get penalized for that period of time, because for every 12 months, as Dan said, you're not covered, you're going to get penalized 10% for Part B and 1% per month for Part D. Okay. So if that's not complicated enough for you, I don't know what is, really.
It's crazy that everyone has to navigate this.
Yeah.
It's surprising to me that
certainly was
it is set up that way. I mean, I can see why, because of all the the history of it and so forth. But you would think at some point someone would come through and fix all this and make it more unified.
Oh, you mean Congress?
But it's just not. It hasn't happened.
It is quite complicated, and then that's why Dan mentioned and I mentioned, go seek out professional help when you're getting ready. The if there's any takeaway from this that you have to get is Medicare is incredibly complicated. It's required by law, right? Or you have to have some excuse not to use it. You will be fined for life if you don't sign up on time. And it's very complicated, so go get professional help. There's free help available through the SHIP programs in the different states. The one in California is called HiCap. Anything else you want to add to that, Dan?
I want to add that I'm so thankful we're done with all of these details in this episode, but I have to say that in 2.5 years, I'm going to have to sign up for Medicare because I'm 62, almost 62 and a half. So I don't have that much longer to go. So I'll have to revisit all of this to do that. But I'm looking forward to the next episode when we talk about something else. Maybe we'll go into the next book episode that we'll go into will be chapter 4, which is the distribution chapter. That's the distribution decision, which is how do you take the money that you've saved over your accumulation life, the nest egg that you've saved over all that period, how do you turn that into retirement income and do it safely? And that's a challenging, difficult, and as you said earlier in this episode, it's a complicated topic. But that's our next one, which I'm looking forward to because I find that very interesting. And there's a lot of things that I put in the book chapter that I think will be eye-opening to folks.
Yeah, I agree. I think that was a great chapter and very eye-opening for me. So these 3 and 4 for me were the most complicated ones. So I'm looking forward to discussing that one.
So we'll do that next time, unless we can find some sort of a current event topic to go over before that. And in either case, I'm looking forward to covering that next week.